It is time to get started. Now, I like to be on time. And let's see. Okay. Not bad. Okay, any question before we get started? Can you hear me and see my screen?
Yes.
Yes.
Okay. Okay, now today we are going to discuss the safety of patients, and the safety of lab staff. One of the most important chapter of this class. Now I am going to go over, but first I have some wake-up questions for you. Okay, now the first one. Okay, now I am trying to test you guys whether you review the course material before you come to the class, okay? Or the chapter we already discussed. Now, which of the following criteria is not a criteria for classification of the laboratory test as weighted or non-weighted tests? As you remember, we classify the lab tests, weighted and non-weighted, and non-weighted tests are moderate complex tests, highly moderate complexity tests. Okay. Now go ahead and send your answers. We have a lot of slides to discuss today. Okay, you also these questions help you to be prepared for exam, okay, which take place tomorrow, right? Okay, now let's see. Okay. Which is not a criteria, okay? Pay attention. Is a tricky questions, which is not criteria for classifications, okay? The frequency of requests for the test is not a criteria for that. No, the correct answer is E, okay? I am sure you know, but you didn't pay attention to the question. Okay, first, try to understand the questions, okay? And then you will find the correct answers. No, okay. I need to clear your response and then go forward. Now, Sally is asked to sign paper for the release of medical records, including her laboratory results. Now, according to HIPAA, she must authorize release of records before her attorney, husbands, or insurance would be permitted to receive and review her records. Which of followings? Okay, privacy, privacy of patients, secure the information about patients and about its lab results are really important. Okay. Who has done? Now C, her insurance, her attorney, her husband. Any of the above is the correct answer. Okay? Any of these person need to get a
They want to see me up, but I can't
permission.
see so far.
So
Get up, beach. Back it up, beach. Beach, 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 beach. Beach, beach, beach.
I can't hear you well. Okay, the correct answer is any of the above. Okay. Now one more. Okay, you remember the chain of custody, right? The chain of custody procedure must be followed for which of these lab tests? I didn't mention a specific lab test, but I described the situation which needed chain of custody. Okay, now some questions also help you to understand the lectures. Okay, a part of information that I need to share with you. Okay, now blood specimen for alcohol level determination, routine urine analysis for glucose or ketone, therapeutic drug threshold determination, okay, or throat swab. Which of the following need to be followed a chain of custody procedure? One more answer. Thank you. Now I'm going to show you. Okay, blood specimen for alcohol level determination is a medical legal situation. Okay, and among these options, the first one is the answer for this question. Thank you. Now let's see. Okay, now it is time to talk about safety of patients, safety of the lab staff, the healthcare providers. Now, a study of laboratory errors showed that about 98% of the errors in the diagnostic process occur in the pre-analytic phases. Okay, we divided the lab process, pre-analytic, analytic, and post-analytic. I am going to show you, but about 100% of the errors occur during the pre-analytic phase. And having recognized the role of the pre-analytic errors, the Joint Commission National Patient Safety Goals has several goals area and that have specific applications for clinical laboratory. We are going to use some of them applied to the clinical laboratory in order to make safe for patient, for the lab staff, okay? And communication and mitigating patient risk are two main areas of the patient safety that we can apply on the clinical laboratory. Okay, now there are some videos that I embedded in my lecture, but now I am going to skip some of them. However, I strongly recommended you to watch them if you didn't that before. Okay, the Joint Commission National Patient Safety Goals are, several goals, but 3 goals areas have specific application for clinical laboratory, and these are identifying of the patient, improve staff communication, and prevent infections. Okay, the correctly identifying a patients by using at least 2 identifiers, such as patient's name and birth dates, it's really crucial. Okay, and also prevention of the infection by using CDS, CDC, and WHO guidelines are also essential to protect our patients and our staffs. Okay, now another institution standards, which call 6 calls of US Institute of Medicine for healthcare delivery. These are not only for clinical laboratory, but also for hospitals, for any kind of healthcare facilities. Okay, safety, timelines, effectiveness, efficiency, equitable treatment, and patient-centered focus. Okay, safety is, which is a main topic of this chapter. Okay, focus on avoiding injuries from care delivered to the patients. Okay, you may remember the Hippocratic oaths. Okay, one of the oaths is do not harm the patients, right? And no, safety is here the number 1. Okay, and the turnaround time of the testing is also about the quality of the labs. Okay, and one of the goals of the US Institute of Medicine. Okay, effectiveness, okay, the avoidance of underuse, overuse, or misuse of the laboratory testing. Efficiency is about to reducing of waste of material, waste of time, waste of the staff. Okay, that means waste of the money, right? And also to provide consistent quality of care, regardless of gender, ethnicity, socio-economic class, or geographic location, is one of the 6 goals of the Institute of the Medicine. Okay, patient-centered focus. Okay, the satisfaction of the patients is the priority of the health providers. Is almost. Okay, now, as I said, we divide the lab procedure in 3 phases, and these are pre-analytical, analytical, and post-analytical. I put here devices, a auto-analyzer, which we are commonly using in the clinical chemistry. The process before the devices, known as pre-analytical. The process after the device is known post-analytical, okay? And the process of the lab test, which is done on the devices is non-analytical phase. Okay, now as you see, there are several errors that can be done during the pre-analytical phases. As I said, about 98% of errors occurs during the pre-analytical phase. Okay, and now I am going to show you in these tables. Okay, as you see, the patient identification, which means failure to use two patient identifiers, or phlebotomy associated negative events such as uh, um, lapse in infection prevention, okay, failure of hand hygiene, or skin reaction to tape, or sharps that we leave in the patient's bed. Okay, specimen identification, one of the most common errors. Okay, unlabeled specimens or mislabeled specimens, order entry. Okay, I mean, mostly we are using a barcodes. Okay, there are barcodes both on the test tube and on the order sheets. Okay, which prevent errors. However, in some case, we have to put the test manually or the name of the patient manually, which may cause a errors. Okay, specimen integrity, one of other common errors. Okay, uh, it's insufficient volume of the specimens or loss of destroyed sample, improper temperature. Okay, while we transporting the specimen, and effective use of the clinical laboratory is other common errors during the pre-analytical phase. Okay, the post-analytical, we are going to discuss analytical errors in a separate chapter. Okay, and therefore I am going to now skip that phases. During the post-analytical phases, there are three common errors: communication of the results, about communication of the results, effective use of the results, and outcome of the result testing. Okay, I mean, if you have obtained a critical test results, okay, you have to let them, the provider, physicians, on time. Okay, failure of timelines in a communication of the critical values. And for some lab tests, we have critical values. Okay, for cholesterol, there is no critical values. It can be 300, 500. Okay, but for glucose, if you obtain a level of blood glucose 600, you have to have a call to the physician of the patients immediately. Okay, if you have a let's say 7.5 milliequivalent per liter of the potassium, this is really is crucial. Okay, and you have to have a call to the patients and physicians. Okay, and okay, effective use of the test results is other issues about the post-analytical errors. I mean, incorrect interpretation of the test results could be happen, and failure of provider to notify patients of abnormal test results is other errors that we can see in the post-analytical phases. This is not about the lab staffs, okay? But as I said before, we all are working as a team, physicians, lab director, and technicians who are working in the clinical laboratory. And that means the total quality of the hospitals is important. It affects all procedure, both in the lab and in the hospital. Okay, now there is here another videos. I am going to skip it, but I am going to show you maybe one or two other videos later. And I also want to give a break around 2 p.m. Okay, then we can go and we can continue after the breaks. Now, still we have time. Okay, a communication, as I said, two main goals that we apply to the clinical laboratory: communication and mitigating of the risk. The need for clear communication is imperative, okay? And avoiding direct communication of an error that harm a patient is unacceptable. And one other unacceptable behaviors that usually we are doing is the medical euphemisms, okay, are commonly used in clinical laboratory to describe medical errors that harm patients, okay, which result in okay, the patient cannot understand what about we are talking. Okay, we are using a different language, okay, to describe the medical errors that harm the patients. But the patient has a right to understand what is happening, right? And therefore, using a medical euphemisms is also unacceptable, okay? Okay, now some other questions. Most of the errors in the diagnostic process occur in which of the following phases? It's not hard, right? Now go ahead and send your answers. Hey guys, come on. Did you send your answers? Okay, in the chat box.
You went through.
Okay, I cannot see the total result, but I am going to. Okay.
Is it A?
Okay. Let's see. Yeah, this is the correct answer is A, pre-analytical phases. Okay. Now I am going to. Okay. Yeah, now I see your, okay. Something is wrong with my internet connection. I'm not sure, but no. Okay, the correct answer is A. Okay. Now, if you know in which phases most errors is occurs, you can prevent them, right? Okay. Another question, to prevent the errors in the diagnostic process, which of the following area, the main area of the patient safety, the Joint Commission National Patient Safety Goals established? If you pay attention, I said there are two main area of the Joint Commission National Patient Safety Goals that we apply in the clinical laboratory, and you have to choose two of them, okay? Communication, safety, mitigating patients' risk, effectiveness, efficiency. Okay, these all are a kind of precautions, but two of them are about the Joint Commission National Patient Safety Goals. Okay. Just I am waiting. Don't be afraid. It can be correct or wrong. Okay. Let's see. Let's see your answer. Okay. First. Okay, communication is correct. The other is mitigating patient risk. Okay. If you take a look the certain slides, okay, communication, and I'm going to show the correct answer, okay. A and C are correct answers, okay. No worry, you have to review them by tomorrow. Okay, this is supposed to be the last one. Okay, which of the following action is the post-analytical, okay, American Society of Clinical Laboratory Science Patient Safety Indicators. Post-analytical errors. Patient identification, phlebotomy, communication of the test result, specimen identification, or order entry. Okay, you may remember, okay, pre-devices, post-devices, right? One more. Okay. Communication of the test result is correct answer. Good job. As you see, it's not hard. You can do that. Yes, you can. Okay, now we need to continue. Okay, now most laboratory accidents are preventable. Okay, we see this is about the laboratory safety now, and you can prevent them by exercising good techniques, staying alert, and using common sense. Okay, and there are two institutions which involve in laboratory safety, and these are OSHA, okay, occupational safety and health and administrations. We call OSHA, okay, and CDC guidelines. Okay, the OSHA standards and CD guidelines, they describe the laboratory safety. Okay, to ensure that workers have safe and healthful working conditions is mandated, and ergonomic also is a safety issue. Okay, maybe most of us don't care about ergonomics, but one of the safety issues. Okay, both OSHA and CDC have published numerous safety standards, and we have to, it is mandated for the clinical labs to follow these safety standards. And ensuring safety in the clinical laboratory includes several measures. These are a formal safety program, specifically mandated plans such as chemical hygiene, bloodborne pathogens, identification of various hazards such as fire, electrical, chemical, and biological, and safety officer and safety coach. These are uh, essential for each clinical lab in order to be sure that the patient result, the patient and both the patients and the lab staffs are in a safe environment. Okay, now, safety officer, okay, is a communicator of safety habits, okay, is an educator of the safety habits, is a role model for safety habits, is an observer of the safety habits, is also is a storyteller to implement positive change. Okay, and usually the safety officer, they are working voluntary. They are used to use these precautions and teach, educate the staff, and also observe any kind of safety issues, and let the lab director or lab manager know if they observe some kind of safety issues. Okay, as you see, there are 5 institutions about safety standards and governing agencies. And these are, as I said, OSHA, Clinical Laboratory Standard Institutes, CLCI, CDC, and you know the last 2 of them from the Chapter 1, and CAP, okay, College of American Pathologists, and the Joint Commission. These are, okay, some of them, they establish safety standards, okay, and some of them govern these standards. Whether we follow these standards or not, they should govern all the clinical laboratories in the US. Okay, now the other studies show that the highest rate of the healthcare associated infections, which also known nosocomial infections, occur in the burn ICU or the neonatal ICU and the pediatric ICUs. Okay, why most common nosocomial infections occur in the burn ICUs? Because their skin most probably is not intact. Okay, and skin is one of the most important protector, right? And since they have a burn of the skins, skin is not intact, and then the pathogens can go through easily and merge in a blood or in a tissue, cause an infection. Okay? And risk factors can be iatrogenic risk factors, organizational risk factors, or patient risk factors. Okay, we have to identify each of these risk factors and take action to prevent these risks, to reduce these risks, okay, in order to prevent our patients and our staff. Okay, there are 3 plans which mandated by OSHA, and these are chemical hygiene plan, hazard communication standards, and occupational exposure to bloodborne pathogens. And each laboratory should know the OSHA mandated plans and also implement these plans to its lab in order to protect the lab staffs. Okay, a hazard communication standards is about the safety data sheets, and which requires that the chemical manufacturer, distributor, or importer should provide the CDS, okay, safety data sheets, and other plans that involved in OSHA mandated plans is occupational exposure to the bloodborne pathogens. It requires that laboratory must develop, implement, and comply with a plan that ensure your staffs is protected from the potential infectious bloodborne pathogens. And also it's required that laboratory have a plan how to manage and handle medical waste safely and effectively. Okay, these two plans, which are OSHA mandated plans, they protect the staffs who are working in the healthcare facilities. Okay, now can I see this one? Okay, we may watch these videos. That one of the video I want that you watch it.
There is a lot of talk these days about HIV and AIDS, HBV or hepatitis B virus, and the dangers of getting infected by coming into contact with someone else's blood. In your profession, you can face many situations that could potentially cause you to come in contact with blood or body fluids from other individuals. Whether it's removing trash that contains a used syringe, handling laundry soiled with blood, or simply cleaning up after a sick child, The precautions you follow for handling these procedures could mean preventing serious illness or even death. That's why OSHA, the Occupational Safety and Health Administration, has developed the Bloodborne Pathogen Standard to provide guidelines that will help you eliminate, or at least reduce, your exposure to HBV, HIV, and other bloodborne pathogens while in the workplace. This video, which is included in Betco's university training courses, focuses on OSHA's Bloodborne Pathogen Standard for the workplace. This video will cover what are bloodborne pathogens, who is covered by the OSHA Bloodborne Pathogen Standard, what is exposure, following universal precautions, protective practices, what if exposure occurs, HBV symptoms, HIV symptoms, and employer responsibilities. Betco has over 300 specialty cleaning products and a full line of equipment and accessories. Prior to using any cleaning chemical, be sure that you read the label and consult the safety data sheet for that product. Before going any further, let's provide a definition for bloodborne pathogens. Bloodborne pathogens are pathogenic microorganisms that are present in human blood and can cause disease in humans. These pathogens include, but are not limited to, hepatitis B virus, HBV, and human immunodeficiency virus, HIV, associated with AIDS. OSHA originally developed the bloodborne standard for healthcare and hospital employees, but it has been expanded to include any occupation in which reasonably anticipated contact with blood or other potentially infectious materials may occur, including someone who may be responsible for the cleanup of blood or body fluids, or even those who remove trash or handle laundry. Within these settings, there may be potentially infectious materials, and how you take care of them can literally make the difference between life and death. Most occupational exposure to bloodborne pathogens occurs when the pathogen comes in contact with the employee's mucous membranes, like the nose or mouth, or breaks in the skin, like needle sticks, human bites, cuts, or abrasions. Body fluids such as blood, vomit, and in some instances, saliva, can potentially contain bloodborne pathogens. But you can easily protect yourself from coming into contact with the fluids by following universal precautions. The Centers for Disease Control and Prevention established the universal precaution approach, recommending that blood and certain body fluids from all patients be considered potentially infectious, and that infection control precautions be taken to minimize the risk of exposure. This is the approach taken by OSHA in the bloodborne standard. The best defense is a thorough offense. Always follow universal precautions, as well as your facility's exposure control plan when handling contaminated materials. This means that at all times, assume that all blood and most body fluids are contaminated with bloodborne pathogens, and that you should follow proper protective practices when handling a cleanup or an exposure. Alternative color coding or labeling of laundry is acceptable if all of the soiled laundry is handled using universal precautions, and the labeling or color coding is sufficient to let all employees know that compliance with universal precautions is required. If laundry is shipped to a location that does not use universal precautions, the bags or containers must be properly labeled and color-coded red or orange. Remember that needles or other sharp objects may be hidden within the laundry. Wear personal protective gear if you are responsible for handling contaminated laundry. Besides protecting yourself, you are responsible for containing the bloodborne pathogens and decontaminating the area so someone else isn't exposed. It is crucial to clean and disinfect the area with the appropriate disinfectant cleaner. After a cleanup procedure, always remove and dispose of your gloves and other equipment in a properly labeled container or a red or orange infectious waste bag. Thoroughly wash your hands with a hand cleaner immediately after you remove the gloves, goggles, or other personal protective equipment. Good hand washing helps reduce the spread of infection and disease. All containers and cleaning equipment, such as mop buckets and tongs used during decontamination, must be disinfected following use. If there is any chance that you have been exposed to bloodborne pathogens, contact your supervisor immediately for specific instructions on exposure protocol. Also, notify your physician. Once an exposure occurs, be sure to pay attention to your health and watch for any symptoms that are related to HIV or HBV. Hepatitis B, or HBV, is a type of liver disease that inflames the liver and leads to liver damage and sometimes even liver cancer. HBV has the following symptoms: fatigue, abdominal pain, loss of appetite, nausea, jaundice, vomiting, diarrhea, light-colored stools, and dark urine. HBV symptoms may not appear for some time after initial exposure. Notify your healthcare provider immediately if you think you may be at risk for HBV. Hepatitis B vaccinations must be made available at no cost to all employees who have occupational exposure. Vaccinations must be provided after initial bloodborne pathogen training and within 10 working days of any assignment, which could result in occupational exposure. If someone should contract HIV, they may develop AIDS or acquired immune deficiency syndrome. Symptoms of HIV infection could include constant fatigue, sore throat, persistent fever, persistent rash of unknown origin, night sweats, persistent swollen glands, mild to severe flu-like symptoms. Just like HBV, HIV symptoms may not appear for many years after the exposure. If you think you may be at risk for HIV, contact your healthcare provider immediately. OSHA requires that each job site in which there is a reasonable likelihood of bloodborne pathogen exposure have a written exposure control plan, and it must be kept updated. Reviewing the plan, at least annually, is an important part of knowing how to protect yourself. Your supervisor should provide a copy upon request. OSHA requires specific documentation from your employer. When an exposure occurs, your employer must maintain certain records for 3 years after the exposure. Now that you understand OSHA's concern for your health and safety, take time to see how your employer has responded to the challenge. You may want to read your facility's written exposure plan. Always take universal precautions when there's a chance you could be exposed to bloodborne pathogens. Remember these protective practices when you're facing bloodborne pathogen concerns. Always wear personal protective equipment. Never eat, drink, smoke, or apply lip balm in areas in which there's a possibility of bloodborne pathogen exposure. Never manually compress trash. Avoid splashing or spattering when cleaning up. Never reuse towels or sponges. Use spatulas, absorbents, or tongs for cleanup, when possible. Handle contaminated laundry cautiously. Use properly labeled or color-coded containers and bags when disposing of or transporting materials contaminated with bloodborne pathogens. This includes gloves, laundry, and equipment. Always decontaminate surfaces and/or areas with Betco disinfectants. Always properly wash your hands. Disinfect equipment and materials used for cleanup, and if you think you may have been exposed to bloodborne pathogens, contact your supervisor and physician immediately. If you need more information, ask your supervisor or check out the OSHA website at www.osha.gov. You can also contact your regional OSHA office.
Okay, should be enough. Okay, I hope that it helped you to understand. Now, I am going to also discuss some of the issues in some of my slides just today. Okay, now, hazard communication standards is one of the other OSHA plans, right? And in this plan, in these standards, which has changed in 2012, and hazard qualification, labels, and safety data sheets included. And as I said before, the provides specific criteria to address health and physical hazards, as well as classification of chemical mixtures need to be is known as hazard classification. And we also labels of the each chemicals is one of the essential precaution. The chemical manufacturers and importers must provide a label that include signal words, pictogram, hazard statements, and also precautionary statements for each hazard classes and categories. And as I said, safety data sheets are crucial. Okay, they should be accessible to each lab staff in order to update their self and also to read as they need it. Okay. Now you see the different kind of the labels is based on the chemicals, the materials that we are using. As you see, there are different kind of labels here. This is health hazards. Okay, if you have a materials, carcinogen materials or mutagenic chemicals, reproductive toxicity materials in a bottle, and is supposed also we need to see a labels like this on each bottles, on each containers, which contain carcinogen, mutagenicity material, reproductive toxicity, and so on. Okay, as you see, each of the labels has different meanings. As you see at the left bottom corner, most common labels, right? Which is acute toxicity, okay? Which means if you have a chemical which causes acute toxicity, you have to put these labels, okay? All these labels is mandated by OSHA and mentioned in the OSHA standards and CDC guidelines. Okay, now let's give a break